Well, it's a privilege for me to introduce another Robin with an I. I don't know quite how she learned to spell her name because I'm Robin with a Y, but I am grateful to be able to share with you just a couple comments. I hope you're reading your book because it does have inspirational information about our speakers. But Dr. Robin Adams Geiger is the CEO and co-founder all over the world. I think she's in a variety. She's in Florida, she's in Colorado, but she's making a difference in terms of nursing equity as far as begins with recognizing the value of diverse voices. I love that. And experience across all levels of practice. So as you see, she's elevating the voice of every nurse to strengthen the workforce. What more could we ask for? Dr. Geiger?
I know. I used to spell it with a Y on purpose in school. And my mom would get really not, yeah, she'd be, yeah, it's an I like a bird. And they used to call me Birdie and all the jokes in high school. Thank you so much, Robin. So I hope you enjoy this talk. Let me make sure I can know where the green button is. Um, Before I start, how many of you have seen the movie Mean Girls? Okay, most of you. If you haven't seen the movie, watch it after this. It'll make you laugh. You'll think back to the presentation a little bit. But I'm a mother of three boys. I'll say it again. So, because I do need the sympathy. I'm a mother of three boys, and I'm the only girl. And they love watching different things with me. I kind of make them watch this movie because I thought it's a little deeper than what it seems on the outside. Okay, it goes into very much what some of the other speakers were talking about this morning. You put someone in an environment, there's bullies, they're mean to someone in an environment, it turns that person into someone else. You may not even be able to recognize them. When you put someone against a wall and you're constantly berating them, marginalizing them, making them feel uncomfortable, you can change the whole dynamic. And we have those toxic circles happening within nursing. And so I hope this presentation helps you think a little bit more clearly on what that can do to your workforce and to your teams. So just full disclosure, this talk is sponsored by Ovita Health. I am affiliated with a lot of other different companies and organizations. And I wanted to make sure that I could speak freely because right now, DE and I is something that nobody should be talking about. Okay. We're going to talk a little bit about it today. And we're going to talk about how you can approach that just by being kind and using your nursing ethics, things that Dr. O'Rourke spoke about earlier this morning. Okay. So again, don't say DEI. There's so many things around it, right? And I have an agenda up here. Dr. O'Rourke's like, we're not agendas. But yeah, I have an agenda still. Valuing every voice and how you can do that. We're going to go through some actual scenarios on how some nurses are marginalized or they're excluded and what that might look like. And I'm sure many of you, probably most of this room, have felt excluded at some point. It is not about race. It is not about gender. This is about a toxic environment. And so we really need to call action to it. Okay. We're also going to talk about, again, impact of exclusion, benefits of inclusion. What does it feel like for them? And when they are included, can make your workforce grow phenomenally as leaders, as nurses, that role clarity, it all comes into focus. All right. So if you've seen the movie, then you'll recall this scene where she's like, you can't sit with us, right? So let me dial back again. So I think her name is Katie, but the principal called her Caddy. Some people that they just chop her name up throughout the movie. She's moved from Africa to this new city, right? She's in high school, all the things, all the horrible things, a new move, new friends, high school. I'm sure you remember it, or you remember someone in your high school going through that. So when we talk about that politically taboo DE&I, how do we approach it now? What now? They're saying we can't talk about it. For a while, we weren't even discussing it, right? And then all of a sudden, it's everywhere. Diversity, equity, inclusion, because we found out that we weren't including everybody. We weren't including in the workforce maybe um, people in wheelchairs who could do the same job as someone walking around. So we really banded together. Everyone started really focusing on DE and I. And it's not about affirmative action, which is something completely different, whole nother talk we can get into. It's just about including everyone, right? So that's why it matters. And, it's definitely challenging, but it's transformative. You'll see throughout the talk a little bit. So just to level set, inclusion versus exclusion, right? So according to American Nurses Association, all individuals, regardless of their background, have equal access to opportunities and resources, promoting a culture of collaboration and respect. That's what we're trying to focus on whenever we're talking about including other people, right? And for exclusion, it creates systemic barriers, unconscious biases, inequitable practices that hinder professional growth, all the things we were talking about this morning, right? And, diversity within the workforce. Like, do we really need to put a number on how many and put them all in buckets or categories if we're doing the right thing in the first place? I don't think so. So you may remember this scene as well. How does it feel to be excluded? Now, this group here, or two of the people in this, they're actually innocent bystanders, right? So they're trying to be friends with her. They're trying to tell her the right things to do, right? But as you go on, we're going to start first with the invisible team member. We're going to go through this scenario, and then we're going to break this down to apply to the student nurse and a couple other scenarios and how they may actually feel. And I want you to take a minute just to think about this in your own setting. Okay. So the invisible team member. So imagine the skilled nurse, years of experience, okay, join a new department. She enters the shift huddle, eager to contribute. She has lots of ideas. She wants to talk too, right? But every time she raises a suggestion, this has probably happened to you before, it's brushed aside or it's dismissed. Oh, thank you for that. Yeah, we talked about that last week. Oh, thank you for that. That was last year when we talked about that. The team leader or other colleagues focus on each other and everybody else's ideas, effectively silencing this one person or this one individual. Think of that. Being silenced they're not being rude. They're just telling, we don't want to talk about that. We're gonna keep moving. How effective it is, how easily you can silence someone and how much impact that can do to that person and their role. So days go by. She's not enthusiastic anymore. She begins to question her competence. Maybe they bringing up the wrong things. Maybe my ideas are old. So this subtle exclusion. So this scenario, it's highlighting just very subtle. You can't really prove it, right? You brought up an idea that they've already talked about. It's not really me, or is it? That's what they're starting to feel like. Okay. So if we move on to next, the disconnected float nurse. Many of you have worked with travel nurses before. Oh, that's a hot topic, right? Whether you are welcoming a travel nurse in the hospital or a different setting, nursing home, or whether you were the travel nurse. How many of you were travel nurses at any point? Only a few of you, like 2 or 3 of you. Okay. And then how many of you worked with travel nurses? Okay. How kind were you to those travel nurses? Can you be honest? Were you really welcoming? I was very kind. They always got the word. They always got the worst ones. I was in central staffing, which was kind of a form of travel nursing. That was when, she's nodding her head. That was when back in the hospital, right? They were forming their own pool of nurses. I was in that central staffing pool. I didn't know which ICU I was going to. You had to stay really on your game. You had to be upskilled. I could go to burn, cardiac, surgical. When I knew when I went there, they were going to treat me like crap. They weren't going to help me. They were going to do anything. So I was always studying. I know. No, they're going to give you the worst patient and they're not going to help you, right? Why does she get to, why does she get to float? Because normally they try to give you a lesser assignment initially, and they didn't like that. Well, think about this nurse. Float nurse who moves between different units each week shows up for her shift, okay? Unfamiliar with team dynamics. She doesn't know their process of talking. Everybody, every unit has their own kind of culture. It's true. Okay. When she arrives, no one offers her any kind of help or guidance on their unit, leaving her to find her own way. And then she can see people talking in the corner, whispering. Everybody automatically has a sandwich and she's starving and she's the only one without one. I know you've been there, you've seen it, right? All right. So the nurse feels out of place. She doesn't feel welcome, and it's making her hesitant to ask for help. So I just want to stop here for a second because I want you to try to put yourself in the mindset of this nurse. She has patients to take care of. What about her patients? Think about just not included, being not included and having that additional layer, that stress to deal with while you have patients who really need you. Think of how dangerous that is for patient care. Nobody thinks about that when they're being mean or when they're excluding people. They don't think about that, right? Okay. So if you remember the movie, you also remember on Wednesdays they wear pink. Okay. I've heard my nurses say that a lot, and they're joking, or are they? I don't think they're really joking. I think they're kind of have this undertone of being mean on Wednesdays or just being part of a clique. I think sometimes the jokes really aren't jokes, right? So, how she felt. No one cares about travel. These are some things that she may have felt, right? I'm only here for a few weeks. It won't matter. That's even more dangerous because what is that doing to her patient care, right? Don't get close to the patients. Don't put any extra effort. They're not going to notice. I'm here for a short time. I'll never fit in here. So I can tell you, most likely, it's ruined her assignment. She's not going to care about patient care. What is it going to do to the hospital? The bottom line of the quality that's coming from this hospital. So we're always blaming travel nurses, but what layer are we giving them of toxicity that's making it difficult for them to do their job? Why it matters? It diminishes her confidence. There's no teamwork there. She's going to disengage altogether. And you really want that engaged workforce. You want someone to have your back because it's really not about just having your back for the assignment. It's about the patient, right? We keep forgetting the patient. And then potential loss of a permanent employee. I will tell you, having been at one of the largest staffing workforce contingent labor companies with 8 company brands, thousands of nurses, we like it when those nurses find a permanent home. And they often do. They'll go, they'll have an assignment, they'll be there 13 weeks, then we want them again. They were so great. Another 13 weeks, we're going to keep them. Okay, great. Because there'll be another nurse that'll come along. So why not? You keep this. This is a great relationship. It's a great way to keep your client happy, right? So that's something that people don't understand, but we want them to be a part. So they're potentially losing an employee, someone who'd want to stay there and work with them in the long run. And then impact on patient care, like I said, very important. Now, this starts really early in our career. When you're a student nurse, it starts right then. When they go into, I recall being a student nurse in the hospital and trying to speak up and being put in my place. Nope, you're just here to do these tasks. But this patient said, nope, they have a nurse, they'll take care of it. Okay, think of that. That's so disengaged and what it could have done to me. Well, I'm determined. You can't push me away. Nothing you can say to me is going to make me not want to be a nurse or do my job. Okay. So, but think about this one. Let's read it. So, consider a student nurse, and she's advocating for a vulnerable patient. This patient doesn't have family present, nobody's there to take care of them other than the healthcare team. Okay. The student notices signs of discomfort and attempts to communicate her concerns during team rounds. And I know you remember team rounds, right? It was life for me. I wanted to hear everything that was happening. Social worker, physician, all of it. I needed all of that information because I thought it helped me do a better job as a nurse, right? I would have, if I was precepting, my students attend these rounds. You need to listen, you need to hear. Well, her insights, again, she was dismissed as less critical than more pressing issues, whatever those might be. Okay. So she's left feeling that her effort to advocate for a patient isn't respected or valued. That's the one thing we don't want to do with a student nurse. Okay. So how would that make them feel? Let's put this in perspective of their feelings. Overlooked during clinical rounds by faculty, right? Or preceptors. The facility or school agrees with them. If they're treating me like this, the hospital, they must be okay with that. They're right. I need to be stay in my place. I don't need to be advocating or passionate. I just need to learn as a student, right? And not invited to participate fully in learning experiences, because that should be a part of their learning experience. How you advocate for a patient, that should be a part of their role identity. So they understand what to do as a student. And then caring doesn't matter as long as you check off your list. And I don't know how many of you had your little, everybody has their fancy little list of report. You remember that? I had mine. I was so happy. I went, printed it, and typed it at home, had my times of what I was doing and had time slots. Oh, I was that nurse. I had a tool belt and everything. Oh, don't laugh. I look good in that tool belt. But I mean, it was, but that's what I was focused on. I wasn't really focused on advocating for my patient, not right away, but had I known that it was so important, that would have been on my list of things to do as well, right? So why it matters definitely diminishes their confidence. It causes a lack in foundational skills at graduation. If they don't have this as a part of their curriculum, a part of this wonderful planning that's happening at St. Mary's, they don't have this in their bucket, their tool bucket, they're not going to have that ability. They're not going to understand that they need to be an advocate as part of their role, right? Lack of interest in specialties. Oh, that's a hard one. If that student nurse is in oncology that day, that could give her a poor sense of what happens in oncology, and she may never want to return there. We need specialty nurses. We need nurses dedicated to different specialties. We need that to happen. Okay. And then less diverse workforce. We need everyone from different backgrounds really sharing what's important to them and being passionate for that patient care, right? Think about, again, impact on care quality. All right, I think this is one of the last scenarios here. The powerless nurse leader. Now, I know we have a lot of nurse leaders out here. How many of you are leading in as a manager, director, executive, VP? How many of you? Oh, wow, most of you. Have you ever put yourself in this position where you didn't speak up for yourself? Remember, I mean, Dr. Rourke, she gave you some key words that you can use that I love. I wrote every one of them down. But how many of you identify as a seasoned nurse leader, recently promoted, right? Excited to share ideas, really, express some concerns on their first 30 days about what they've been seeing. That first 30 days is huge. And I always ask any of my directors or clinical managers, what do you plan on doing in that first 30 days? What's your 90-day plan? Because I want to know where they're focused. Are they too focused on one thing where they're going to miss the bigger picture? It's important, right? But this person, they have it figured out. They already know. They've been looking, they have some concerns, and they attempt to speak up at a leader meeting, right? Meeting, okay? And they're told that their role is to keep the nurses happy, okay? And retain staff. That's what your role is. I think that's not really the limit of their role. right? Okay. So the meeting progresses without their input. This person is silenced. They don't know what to say anymore. They've been told by their colleagues that they're just supposed to keep the nurses happy. So imagine what he may have been saying, or she or they may have been saying something about quality, something about, errors that they've seen, dysfunction within among teams, toxicity, something that can really bring a more cohesive group. And they were dismissed. So let's think of how it made that nurse leader feel. So they were sidelined in those strategic conversations. They weren't able to really be a part of those conversations. They were ignored in broader dialogue. That was a conversation that they had every right to participate in. And the reason I'm really wanting you to think about this, whether you're a leader, whether you've seen this happen to your leader, say something. Let's try to do something about it so that this doesn't create this toxic work environment, because it can happen to you. If you don't say anything when you see this happening to someone else, think about what happens when it's your turn to be in that role, right? So limited in critical areas like policy, like I said, team cohesion, and then their insights are not valued. How disheartening is it if you take on a new job as a leader and then you find out in like your first or second meeting that they don't really want your opinion? So you have the promotion, but if you're the person that I would think that went into nursing for the right reasons, you're not going to want that role. Why would I want to just be here and not give everything I have to this position? And then why it matters, right? So this disengagement trickles down. If it's happening to them, they're going to do it to their team. Okay. After a while, this is new. This is new behavior. This is learned behavior, right? Decrease in nurse retention. No one's going to stay around for that. It's going to decrease the morale of the team. Policy and procedural gaps, because, oh wait, he saw it, but he wasn't allowed to really talk and say what happened. So a year later, when you find it, you're going to want to ask him, why didn't you say anything? Right? And then the impact on quality care is it's just staggering. The way it can affect metrics, ways research within the hospital, really so many different things. Innovation, it just stagnates. You want to hire people who can do a better job than you, or you want to hire someone because of the amazing knowledge they bring. If you're not allowing them to be themselves and to really grow, then why put them in that role? All right. So I know you remember the principal, right? They called her Caddy. How does it feel to be included? We can all do better, right? And it doesn't have to be about DE and I. It could be about just going back to your nursing ethics, just ethical treatment of patients and colleagues alike, and being respectful. So when you're trying to create these inclusive practices, you want to foster psychological safety. Someone should be able to express themselves. They should be able to say in a meeting or work meeting or work group, right, what they're feeling or what they're seeing. You should encourage mentorship and peer support. And if you've heard me speak before, I'm really passionate about mentorship. It, it's huge in so many different ways, especially if you're doing peer-to-peer mentorship. There's so many different things, cross-collaborative mentorship, but it's really important. Bring them in, okay? Establish transparent communication channels. So if you're in a team and you have a nurse and they don't know what to do, let's say this nurse, I mean, they don't know who to go to, what to do, that's wasting time, patient time, care time, all of that. What you need to do is make sure that everyone understands where to take certain complaints, who to go to for certain issues, whether it's quality or, logistics. That's a very important onboarding principle as well. They need to understand what to do with the information that they receive. And then reminders, again, about nursing ethics. That's huge. They can tell you that, I've been in a couple different roles. Yeah, I won't even age myself. Okay, I'm 50. I think I look good for 50. Okay. So, but I mean, some of these jobs we never talked about Nursing ethics. We didn't talk about practice standards. We didn't talk about anything that was expected other than the tasks. Again, it was about a job. Didn't talk about role. This everything that you're receiving today is so timely. It's happening over and over again. And the more we get away from these conversations, the more difficult it becomes to actually have a real cohesive quality team. Implementing shared governance models. I mean, I promise you, we didn't do these talks together. We weren't sitting together when we did this. This is just how it's rolling in. And then advocating for marginalized or excluded individuals. That should be a part of who you are, not just your job, not just DE&I policy. Oh, it's policy. I have to do it. I hate saying that. It should be about who you are as an individual. This person's not being, I mean, can you listen to her for a minute? You guys, I'd like to hear her idea. I'd like to hear his idea. They had a good point. Can we go back and listen to that point? These are some good ways to bring that back in to stop this from happening in these different circles. And then some benefits of inclusion, right? Higher job satisfaction and retention. We really want to keep our nurses around. You've heard over the years, especially after the pandemic, people leaving, going to be baristas, like, Starbucks, that's my retirement thing. That's what do we want them to leave now when they just got out of nursing school? They're passionate. They have so much to give. No, we want to keep them, right? And then enhance patient care and safety. That's where, again, that quality hat's coming off. I want to hear what someone else has to say. It doesn't have to be about me creating a policy. What does everybody in the room think? What's happening among you? What are you seeing? You're frontline with patients. What are you seeing? And then increased innovation and problem solving. Think about it. There's some of us who use Instagram, some of us don't. Some of us use LinkedIn, Facebook. There's so many different places for us to get ideas from. So if you're not open to everyone, you'll miss out on a lot of those different ideas and innovation. Cultural competency is huge. Just being competent. Different cultures. Maybe they don't want their lights on. Maybe, they don't want five people at the bedside getting cleaned up. They may want just one individual. So you have to really consider the culture of your patients as well, and remember to speak up for them, and then for your colleagues as well. And then innovative ideas from passionate sources. They come from everywhere. Going back to ethics, and this is one of my closing slides here. If we're looking at the core ethical principles supporting inclusive practice, these should look familiar to everybody, right? Autonomy, respecting individuals' rights and perspectives. That means everybody. We're expected to do that as part of our job, as part of our role, right? Justice, promoting fairness, right? Beneficence, creating a supportive environment. All of these we've all heard before, has nothing to do with talking about DE and I, but it's a wonderful tool to bring all of those different elements back to the table, right? Non-maleficence, preventing harm through cultural awareness. I mean, think about this. Do you really have to be worried about whether you say diversity, equity, or inclusion if you can bring these principles back to the conversation? All right. So in summary, I don't know, but if we're going back to this movie, if you saw the movie, remember what she did with her crown. At the end, when she learned that, okay, I'm being a bully. It finally dawned on her, I'm being just like they are. They were bullying me, and now I've turned into bully. Friend that was, I don't know, I think she got hit by a bus, right? I know it's funny though, but you have to see the movie. It is hilarious in the movie. She got hit by a bus. She's in all of this, supportive wear, and she's standing there trying to become, okay, I can't tell you this part if you haven't seen it. However, I can tell you that she shared her crown with everyone else, and that she finally learned what it meant to be inclusive, to consider how someone else feels. So the impact of exclusion. severe. It really is. So make inclusion, don't make it a policy, just make it practice, something that you do. If you haven't spoken about it in your circles at work, then tell them we can talk about this without saying those three little letters that are so harmful to everybody, right? We can do that. And then maybe different organizations never considered those three little letters and they didn't have to. If they were already practicing kindness and they were already being inclusive. So we don't want to be on the other side saying, you don't look at DEI. It doesn't matter. Go back to your nursing standards, go back to your practice, your ethics, and remember those things. Okay. And then call to action. We want to work together, right, to create this culture where everyone's accepted. And the student, right, the nurse, start early. Accept those students. I mean, they have ideas too. A lot of them are coming from different, like, I've met some students, they were engineers before, and they decided to go back to nursing. They have different ways of looking at things, right? Include logistics. He was talking about the nurses station, how he couldn't get around. I'm like, oh, that makes sense. That makes a lot of sense. Those 3 minutes of taking you to get outside this beautiful, abstract sized nursing station could be life or death to a patient. So just consider everyone and what they have to bring. Okay. And that's all I have. Good. Thank you. Feel free to connect with me on LinkedIn if you'd like to, and I'll take any questions that you might have. If you haven't seen the movie, you need to see it. I know everybody's hungry. So what questions do you have? Be happy to answer them quickly. Yeah. Sure. So nice. Okay, thank you. Thank you. I appreciate it. I did a similar talk for Vanderbilt University in January, and they really loved it. And they loved the fact because they're like, what do? We can't talk about DE&I. What can we do? We do what you did before DE&I. Do it better. Right? Yeah. I told her it's not technological. That's okay. Is it on? Okay. Well, it's red. It's supposed to be green. No, it's okay. They made it magic just for you.
So I want to frame this. This is beautiful, and framing it within the code of ethics is really visionary. I'm going to take it one step further. There is not one scenario up there that she explained that creates exclusion that isn't precursor to harm.
Mm-hmm.
So if you come from a professional role orientation, you do no harm.
Mm-hmm.
And by excluding, you then truncate the transfer of knowledge. If the person doesn't have the knowledge and they hurt somebody, you both go to court, the person who didn't tell and the person who hurt. If you, in fact, don't listen, same thing. Each and every one of those scenarios undermines our covenant to do no harm. So I think you could take it one step further, which is it isn't just the code of ethics, it's the entire concept of professionalism, and recognize that for those of you who are in management or are not, you can say, help me understand why you think excluding me is going to help the patient. Somebody needs to stand up to those statements. And I think you can. This is a beautiful example of how to do it. Thank you.
Thank you. Thank you so much.
I had a comment
Yeah.
quick. You saw me nodding as we were talking about being the central staffing office nurse. That was me. I lived it and had some really positive experiences and had some really negative experiences. And I can totally relate with that. And I wanted to share with you some of the things as a leader now that I've implemented because of those negative experiences. That's part of my charge nurse training is how to welcome new staff to the unit, whether they are students or whether they are a float nurse or CSO nurse or anything like that. And then they're introduced in the shift huddle to all of the caregivers, and they're given a tour. The unit secretary gets trained on how to give them a tour and provide them the resources that they need. And then I check in with them as a leader. I think it's our responsibility too to make sure that they have what they need to work here for the day, and thank them for coming to help us, because if they weren't there, it would be me out there helping the staff. So absolutely, that's all part of it. And I'm curious to know what things you have, like if you care to share some of your personal experiences, maybe that have kind of shaped, some things that you have implemented.
Oh, absolutely. I can tell you one of the experiences that I had, and timing is everything, right? So I had just lost my mother. My mother had passed away. Nobody knows this. I'm going to a unit that nobody knows me. I'm floating to this unit. But had they had just the decency to welcome me, to be supportive, it would have made my week so much different. I literally was in tears leaving. And it hit me more, I think, because I was already so fragile, right? But we don't know what everyone's dealing with outside of their job, outside of nursing. So think of taking this a step further and saying, okay, you're excluding someone and you don't know their level of compassion. You don't know their level of understanding, their level of stress. It goes way beyond. So that happened to me. And I think having those negative reinforcements really help you as a leader. So that helped me as a leader. One other thing, and I shared this before, is when my mother had her first heart attack, I was in nursing school. I was in a diploma program at Santa Fe. I shouldn't tell because I'm about to say something bad. Okay. I was at a school. Okay. And I made a C on that test because they would not let me retake it. They wouldn't let me postpone taking it. You have to take it with the class or you just won't take it at all. You get a 0. So it's back then you stay with your cohort. So, you have to just take it. So I took it, but I could not concentrate. It was literally the day after she had her heart attack. She was in the hospital. And I made a C. And when I went to my professor to talk to her about it, she told me, well, people like you do better in the LPN program. That's what she told me. And she's like, you can stay in this if you want. You may not make it out of this program, but you would do much better in the LPN instead of the RN program. She didn't say who people like me was, but I could decipher, unless she was talking about short people, that she meant brown, black, African American people. It hurt me to my core. Let me tell you one thing it did. It fueled me to my core. I went on and I would hear that along with a couple other thoughts. Like my sister's like, you're never going to get out of nursing school. That was more fuel. Just give me that more fuel to get my doctorate and continue and help other people. But those negative things really helped me, but somebody else maybe not. Not everybody can just brush things off or get angry and decide to do better, So I think being excluded or being pushed aside in today's time after the pandemic, with everything that's happening all the climate that's happening right now, no matter what side you're on, it's a lot of toxic environments out there. This isn't the time to exclude someone or make them feel powerless. So I hope that example helped. Yeah. Sure. Yeah. Yeah.
Um, I'm also living it. I lived it and I'm also living it.
Sorry.
Not because I was part of travelers or any float pool, which I will be doing a shameless plug, poster number 10 for tomorrow. Thank you for validating that and emphasizing that we really need very much great support for traveler nurses as well as float pool nurses. And it is in alignment with, like I said, poster number 10 for tomorrow. And I will also share some outcomes of the practices that we integrated with that. And I really appreciate what you have talked about today.
Thank you. And if you didn't catch it, poster 10